Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health and Health Issues. We will continue today with the problems of the back, neck, and we'll try to eliminate the neck and back problems as much as we can. Yes, you can be part of that, of reducing your pain. Yes, you can help yourself diminishing the problems of your back by continuously assuming good posture, stand straight, sit straight. Don't sit for too long using the computers, more than 30 minutes. Stand up and walk around, come back again, and correct your position continuously. And also, when you stand, pay attention to the problems while you're standing. Don't bend forward from your head, so forward head posture is not good. And also your stomach not to be out, that tuck it in, get it straight, so you assume a good posture for your back. Last time we talked about some reasons for low back pain. We talked about the muscle spasm. Most of the back problems come from muscles. These are good news. So if you hurt your back, don't get very afraid. Back pain is like any other pain. It can go away if you correctly manage it. And most of back pain, they will go away by second or third week. 98% of low back problems should be completely cured by 4 or 6 weeks maximum. Only 2% of back problems may need surgery. 2% only may need surgery. So please do not rush for surgery, because a lot of people, they think when we have low back pain we will need surgery anyway. No, that's not correct. Then only 2% will need surgery. Last time also we talked about the disc problems. The disc, that the area in between the vertebral bodies, which may be degenerated, reducing the size between the two vertebral bodies, and that will cause the pain to increase because of several factors. And also I mentioned that you may feel pain while you're walking for a short distance. This is not a good sign, but it tells us a lot of things about your back. If you walk for a short distance and then you feel your leg heavy, you may have a spinal stenosis. Spinal stenosis. Well, let's look at the picture so you know what the spinal stenosis is. While you're looking at the picture, remember my points that I mentioned before. If you have that, please consult with your physician, with your doctors, before you diagnose your own self, because everyone is different. Spinal stenosis mean, I need to look at the pictures one more time, please. The spinal stenosis, this is the vertebral body. You have here a foramen where your spinal cord, in Arabic النخاع الشوكي, comes out of that part. And this part, this area, this foramen right here may be reduced. So you'll find the size of it small. See, here is the size. That's the normal size. And this might be reduced. This is the abnormal size. There's very constricted spine. And that may cause pressure on your spinal cord, and with different symptoms. Some of them may be weakness of the lower limbs, inability to walk for long distances, or continuous numbness and tingling. If it is maybe one side or both sides, most commonly if it's spinal stenosis, maybe both sides affected, and that will increase your ability to walk and walk regularly. There are some other reasons for the spine problems with the facet joints, called the facet joints. If you remember, we talked about joints in the spine that run right in between the vertebra. This vertebral body and this vertebral body articulate with the joint in between. This joint right here, if you look at in the other picture, it is degenerated, came to close contact to each other and press on the nerve. So there's some pressure on the nerve right here, and that is because, again, of degeneration, maybe because of age or because of pathomechanics, improper posture. Here I will again ask the cameraman to follow me because I'm going to stand up. So I'm standing up here. If I have a posture that my stomach is forward, and I will put a lot of pressure on the back side of my spine. Normally, I have to stand up this way. If I'm, yeah, they keep that close picture, please. So if I'm standing this way and my stomach forward, there you go, my stomach forward, that will put a lot of pressure on my back right there. And the reason for that is when you stand in the normal standing posture, most of your weight will be transmitted through the vertebral body. And if you look at the picture on the screen, most of your weight will come through this way. About 75% of your weight should go through the vertebral body. Only 25% go through your joints in the back side of your spine. If you have a protruded abdomen in the front, your abdomen is too big in the front right here, that will change that distribution. So you'll be putting more weight on your back side. And that is reason for a lot of back pain come from that bad posture. And the correction of that very simple is to tuck your stomach in, do some exercises to strengthen your abdominal muscles, and that will reduce the pain on your backside. There are some other reasons for low back pain, which is a little bit more than the disc lesion. It is in the bones itself. The bone may be fractured or compressed. One of the most common fracture of the spine is the spinal compression, and this comes from the weak bones, osteoporosis. For the ages of 50 and above, in the female side, and they are more vulnerable to compression fracture because of the osteoporosis after menopause and the weakness of the bones, lack of activity, not enough walking, and that will lead to weakness of the bones of the spine, which may lead to compression fracture. The compression fracture, that means the part of the vertebra, if you go back to the picture, if you will, if you look at this part right here of the spine, this is the normal vertebral body, intervertebral disc in between. This one is compressed, is fractured. And if you have that fracture, that will diminish your curve, and some of them, they have hyper or increased kyphosis, where the curve of the thoracic spine, instead of this way, will be more steep, more rounded forward, and the head will continue going forward because of that fracture of the spine. How can we deal with all these problems? Again, the good way of managing your pain is to know exactly what was the reason for it. The first thing is to be evaluated correctly. Consult with your physician or your physical therapist. Be evaluated for your clinical symptoms, your mechanical low back pain. Most of the people, they have mechanical low back pain because of the posture. Once you identify the reason, you need to follow directions. Follow directions by sitting properly, using the computer properly, standing properly, and increase your activity level. For sisters, Assalamu alaikum, sisters, please walk, walk and walk. The osteoporosis is being now documented that you can treat it, manage it by walking. So if you walk at least 30 minutes a day, that will reduce the risk of your osteoporosis. Actually, some of the research now say that it is a treatment for osteoporosis, just walking, and you will prevent a lot of problems and stand up correctly, so you prevent kyphosis or compression fracture on your spine. I guess this is the part of the spine that I want to discuss today, most of the reasons of the low back pain, and back again to the risk factors that don't smoke, increase your fluid intake. If you are at risk at your job from sitting too long or lifting, please evaluate that and take care of it. And if you are overweight, make plan to reduce your weight, exercise regularly, and watch us next time. Next time we'll give you more details of prevention programs, how to deal with your spine or if you have pain, or how to lift correctly, and other tips will come inshallah next time. So join us, take care of your back, and stay healthy, and read Quran. Quran is comfort to your heart and rest to your body and mind. May Allah subhanahu wa ta'ala prevent all harms from you and stay away from all bad things, especially the bad posture. Don't sit this way, sit that way. Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome again to health program, and today we will address some of the prevention methods that you can use to control your back pain or to prevent it in the first place. Today we will demonstrate to you things that you can do. However, my disclaimer again, if you have back problems, neck problems, please consult your doctor, your physician, your physical therapist before you demonstrate any of the things that we will do today, inshallah. I hope that you also did some of the things that we asked you to do, especially walking, good posture, sitting correctly, standing correctly, moving around. Don't sit for more than 30 minutes. Get up, walk, move your muscles, stretch your back, so you will maintain good health, inshallah Rabbil Alameen. One thing that I have not addressed, that the standing posture, and I need to stand, so I show you how to demonstrate that while standing in the prayer. Standing, say Allahu Akbar, put your hand. Now, some people, they think that khushu' is to lean forward and to that, they call that humbleness. I will call that kyphosis, not humbleness. That humbleness is in your heart, not in your physical body. Rasul sallallahu alayhi wasallam, Prophet Muhammad, peace be upon him, ordered us to look at the place that you will prostrate. That's exactly mawdi' al-sujud. So that if you stand up correctly, put your shoulders backward and look down. That is great posture for your neck. Look at I will go to the side so you look at my neck here. Here is what you call khushu', and I call khudu' maybe, or kyphosis. But standing correctly, get your neck backward. That will prevent the kyphosis and will get you good posture in your prayer, inshallah Rabbil Alameen. This is one. The second part is, I need you to know that prevention is much better than treatment. So we need to prevent back pain, not to treat the back pain, if we can. How we prevent back pain? To prevent that, you need to exercise regularly. You need to take care of your lifting. When you lift things, or you move around furniture, boxes, anything that you need to do that carefully, and not to exceed the pressure or to increase the pressure on your lower back. Now, I need you to pay attention, look at the picture first, and then I will demonstrate that to you. You have one here on the right. This is the right way, and this is the wrong way. The right way is to come close to the object that you will left. So I will ask the cameraman to help me come to the box that I will left. This is a big box for me that I need to carry. So first I will stand close to it, evaluate it, and see if I'm able to carry it or not. If I am, I will bend down. There are two ways to do it. Either you bend this way, so you open your legs, bring the object close to you, so manage to get that very close to you, your chest, without bending your back. So bring that close to you first, and then use your leg to stand up. Notice that I go down and stand up without bending my back. I'm not bending my back. I'm bending down, using my leg to do so. Now, when you left that, I will do that again so you'll follow up with me. I'm standing close to the object, come very close to it, evaluate, is it heavy or light? Am I able to do it by myself? And then I'll go down. You may open your leg this way, or you go close to it and get one leg forward, one leg backward, and you go this way. Either way, that is correct. I would prefer that you go this way, so you bring the object very close to you. Bring it close to your chest, so you minimize the pressure on your back. Keep your back straight and stand up with your legs straight. Right? Going down same way, you bend your knee, bring it close to the ground, and leave it down. That will prevent any injury to your back. When you are not able to do it, ask for help. Ask for help. The object is heavy. Sometimes we feel that, oh, I can do it. And you carry it, and they say, oh, my back hurts. So don't do that. Pay attention to your back, to your health. So do not try things that you are not able to do. I will ask Syed to come and help me to carry that because it's heavy. Syed, would you come please help me? And when I ask for help, I should communicate properly to the one that will help me. Not just ask for help and then everybody's lifting by their own way. No, you explain what to do and do it carefully. And I assume maybe Syed is not able to speak English, so I will communicate with the language that he speaks, and then we'll translate to you. Assalamu alaikum. كيف الحال? Can you lift? تقدر ترفع ده معايا إن شاء الله؟ طيب عايزك تيجي قريب لي. assume the same position. على أيوة رجل ورا شوية. بس قرب شوية أيوة. And let's go down and go down. Hold hand. So what I did now, I explained to Syed what to do, come close to the object, and then bend down, and then we'll evaluate that together. ندفع الصندوق and hold it and carry it. ارفعه معايا. تسخن. هل heavy؟ تقيل عليك؟ كويس؟ Can you help me with that? طيب. So we evaluated both of us, and I will tell him on count of 3, we will raise up, keeping your back straight, and also use your leg, not your back. هنعد ل3. على 3 هنرفع واستخدم رجليك، ما تستخدمش ظهرك. keep your back straight. Ready, Syed? Ready? 1, 2, 3. So went together, and that will be a lot easier for you to do. And when you move together, and you give good direction to the helper. If you are not giving good directions, you may hurt yourself. That try to explain it in details, so you will get the proper lifting techniques without hurting your back. We'll go down again, same way. So you bend and bring it down and hold it. And that's it. Thank you, Syed. Jazakallah khair. Assalamu alaikum. If I am by myself and then carry the load, so I will go down again, hold it, and I brought that close to me when I stand up, and I need to transfer that object. Twisting is not recommended. that move your leg and move with you. Take steps, even though if it's very close. If I need to bring that to the table, so if I turn, that will hurt my back. I will take a step and another step and then lower it down to the table. Go back again and I lower that all the way down, and that would be the proper lifting techniques for the boxers. If you go back again to the picture on the screen, please. This is wrong. This one is wrong. Right here, see that the back is bent forward, and he is using the back muscles to lift all this weight, what may injure your back. But on the right way is to keep your back straight, and use your leg to lift the weight. All right. Bend your knees. Do not twist. Hug the load, bring the load close to you, and avoid twisting. Avoid twisting. Main parts. 1, evaluate the object that you will carry. Ask for help if you need help. Communicate properly with your helper. Not just ask for help and just haphazardly carry the load. No, you need to communicate with them how to help you to carry the load. And when you carry it, bring it close to you. Bring that load close to you. The reason for that, because if you stand and bend forward, you increase the load on your lower back. If you stretch your arm forward, you're further increasing the load on your lower back. So what you need to do is keep that load close to your body and then use your leg to lift it up. Don't twist while you're carrying the load. Hey, sister, twisting is very important point to you, even that load is very small in your kitchen. I know your kitchen is like L-shaped, and you're moving things from the stove to the countertop, and you may be twisting your back. Use your leg. Use your leg. Use your leg. Don't use your back, because twisting the back may hurt your back. This is, if you look at the screen for a second, this is how is the load that when we measure the pressure on the lower spine, this is the least pressure, lying flat. Standing is increasing the pressure. If you bend forward, you further increasing the load and then increasing it and increasing it too many times. So please avoid bending forward for no reason. Utilize your lower leg muscles to carry the load. Do not twist while you carrying the load. Bring the load close to you. Ask for help if you need help, and continue to practice exercises, walking. Drink enough fluid and say your adhkar. If you say your adhkar, that like the morning dhikr and the evening dhikr, that will comfort your heart, bring relaxation to your muscles, and also help you to enter the Jannah of Allah subhanahu wa ta'ala. Pray for me with you. Let's get together, get in the Jannah while we are in a good heart and good health. Jazakumullahu khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh.